In the heart of Garissa County, young girls dream of a bright future, but a hidden threat could shatter those dreams. Cervical cancer, a disease that claims the lives of far too many women. Cervical cancer is the fourth most common cancer among women worldwide, responsible for 7.5% of cancer-related deaths. Current estimates in Kenya indicate that every year, 5,236 women are diagnosed with cervical cancer and 3,211 die from the disease. In 2019, Kenya's Ministry of Health took a bold step, introducing the HPV vaccine for girls aged 10 to 14. Yet, misinformation, low awareness, and the COVID-19 pandemic have hindered progress. In Garissa, cultural beliefs pose an additional challenge.
There are so many myths and misconceptions that are related to this vaccine use for our girls 10 to 14 years. Some of the myths are, the parents are saying that the girls will be, it is going to lead to infertility and maybe give them, due to safety problems of the drugs, they will have problems in future life.
But change is on the horizon. UNICEF, the Center for Behavior Change and Communication, CBCC Africa, and the Ministry of Health are working tirelessly to raise awareness and dispel myths.
There was a lot of resistance for the HPV vaccine. You'd notice that even in the recent years since the vaccine was actually launched, the county itself has, I think, one of the lowest vaccine uptake one of the lowest HPV vaccine uptake. Because back then when we were doing this in July, I remember as a county itself, it was placed at, I think, not more than 5% of the adolescent girls in the county actually being given the HPV vaccine. So resistance in some of these communities was one of the biggest challenges.
One man has emerged as a champion for change, Mzee Mohammed. Mzee Mohammed's influence has been profound. He has not only convinced his own family, but has become a trusted voice in the community.
Mimi mwenyewe nimechukua watoto yangu kutoka shule wakiwa wanasoma na nikapeleka kwa chanjo. Na sasa niko tayari tena nichukue wale wasichana yangu watoto wale walizaa na vijana zangu wale watoto walizaa tena niwapeleke leo. Kwa sababu nishafahamu ya kwamba kujikinga ni bora kutibu. Na wahisi wazee ambaye wanakataa hii chanjo wakubali ya kwamba hii chanjo inatibu lakini haiui.
As we are going to the second day to Iftin Primary, of course we had some resistance from parents, because there was one gentleman who stood up and said, we can't accept the vaccine. I think it is wrong for our girls to be vaccinated, and left. So he kind of incited the meeting we were having with parents. But now Eboman, this gentleman, stood up and actually tried to convince parents to stay, for them to hear what we went actually to tell them.
Despite the challenges, progress is being made. The County Health Directorate reports that various measures are being implemented to address this challenge, including engaging religious leaders, educational stakeholders, and other community figures.
We have involved the religious leaders. One is involvement. And by involvement, we have to demonstrate to them this vaccine is safe. These vaccines protect the beneficiary from cervical cancer. It's one of the methods that is proven that is the best preventive measure. And then we develop a package which the sheikhs, the religious leaders, are able to offer even in the mosque. So in terms of the sermons, so they're able to give that information to the community, and at the mosque. That is actually so that the people now believe more that yes, despite previous announcement, but now that at least we have made a lot of engagement with the health departments, and we have ascertained that this vaccine is safe to the populations, and we are advising the population to take. That should be heard from the religious group.
The fight against cervical cancer continues, but with every vaccine administered, hope grows stronger.
Msichana yeyote ambaye bado hajaolewa, hajaonana na mwanamume, maana mwanamume ndio carrier ya hiyo ugonjwa, apatiwe hiyo sindano free.
Together, we can create a future where all girls in Garissa and beyond are free from the threat of this preventable disease.